Hello, Senator. I really appreciate the opportunity to meet with you today to discuss an issue that deeply affects both the nursing profession and public health. I'm especially grateful for the work your office has done to support antimicrobial stewardship and patient centered care. I believe you and your office can play a vital role in advancing ethical, evidence based solutions for this issue.
Hello, thank you for reaching out and coming in today. This is an important topic, and I'm looking forward to hearing your perspective as a nurse. Please go ahead and introduce yourself and tell us what brings you in.
My name is Wendy Rantong, and I'm a registered nurse and a graduate nursing student at Azusa Pacific University. I work closely with patients receiving end of life care and regularly see the dilemmas faced by families and clinicians around whether or not to use antibiotics in the final days of life. I'm passionate about end of life care and I'd like to share some observations from the field and a specific policy recommendation that could help address both ethical dilemmas and public health concerns. As a nurse, I've been trained to uphold comfort, dignity, and evidence based practice, yet often find that antibiotics are prescribed reflexively, even when there's little chance of benefit and real potential for harm. And this pattern isn't isolated. Up to 90% of terminally ill patients receive antibiotics in their final days, often without improving comfort outcomes. This issue is especially concerning when we consider the national threat of antimicrobial resistance. As a frontline healthcare professional, I see how this problem is exacerbated by the lack of guidance for providers in hospice and palliative care settings.
Those statistics are eye opening. It's concerning to hear that antibiotics are still being used in ways that may not benefit patients at that stage.
Well, would it be alright if I shared a real patient story that helped shape my understanding of this issue?
Absolutely. I think a real life example will help highlight the concept clearly.
So let me tell you about Mrs. J. She's an 84-year-old woman with advanced dementia and terminal cancer who was on hospice. Her daughter insisted we continue IV antibiotics even though the infection was not treatable, and Mrs. J was unresponsive. She ended up developing severe diarrhea from the antibiotics and passed away in pain. That moment stayed with me. And this isn't just about one case, it reflects a broader reality. Nurses and providers want to do the right thing, but when there's no policy guidance and emotions are high, the standard is often to treat. This can result in more harm than good. I've seen the moral distress it causes nurses and providers who want to honor families' wishes, but know that these medications may cause more harm. We need a clearer path to guide these difficult decisions, one that respects patient goals while also promoting responsible antibiotic use. It was this experience that led me to start advocating for clear national regulations on when and how antibiotics should be used at the end of life. If it's alright, I'd like to share a few specific ideas that could help address this problem.
That's a powerful story. It really illustrates the emotional and ethical complexities providers face and why better guidance is needed. What do you recommend?
Well, I'm here today to ask you to, first of all, support the development and dissemination of national guidelines on antimicrobial use in end of life care, and to ensure these are integrated into advanced care planning tools like the POST forms. Additionally, I would like to ask you to provide federal funding to support nurse led education initiatives that promote ethical antimicrobial decision making in hospice and palliative care. These efforts would reduce unnecessary antibiotic use, support family communication, and strengthen our nation's response to antimicrobial resistance, which your administration has previously demonstrated leadership in.
Those are very actionable and aligned with some of our current public health priorities. I'll be happy to share this with our healthcare team and see how we can support these ideas. I think our office would be especially interested in the connection to antimicrobial resistance.
Well, I want to thank you for meeting with me. I truly admire the work you've done on public health and stewardship, and I'd be happy to provide policy briefs or connect you with clinical experts in palliative care. I'd also welcome any opportunity to support your office's work in this area or participate in future briefings. Would it be okay if I followed up with your staff next week to provide written materials and see how I might stay engaged with your office?
Absolutely. Please do send us your policy brief and any supporting resources. We appreciate your advocacy and the critical role nurses like you play in these discussions. I'll make sure your message is shared with other members of Congress. Let's stay in touch.
Thank you again for your time and your thoughtful responses. I truly value this conversation and look forward to continuing it. Have a great rest of your day.
Thank you.